So now this being your first time ever adjusted.
Oh, I'm coming back. It was great. First and second grade.
First and second grade, okay. Alright, so you're dealing with a lot. How many students are in your class?
Well, I do small groups, so
okay.
Yeah, so I only have 12 or so at a time.
Well,
that's enough.
I have one
that's
son.
Enough,
and one son is enough for me.
Yeah.
Yeah. Alright, yeah, and I actually have my cousin's wife is a kindergarten teacher, and I know what she goes through and the stress, and especially at that young of age, they're all over.
Yes.
Okay, so low back pain, that's what the main issue. Okay. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here, and she is a teacher, first, second grade, primarily low back pain, correct? Okay. And how long has this been going on for?
I would say probably about 2 years.
Okay.
Yeah.
All right. And when you have that pain, it's all in here. It doesn't travel into the legs. It just stays in the low back. When do you feel it most?
Most of the time it's when I get up in the morning times.
Okay.
Yeah.
So in the morning it's worse. In the evening?
It's when I sit down for
like extended period of time.
For a while, I get stoved up and I have to kind of ease up and kind of bend and work it out.
Okay. Any sharp pain, or is it just more of like a?
No sharp pain.
More like an ache.
Yeah.
Okay.
Yeah. Just ache.
All right. So what we're gonna do, I'm gonna have you stand up. I want to put you through some orthopedic tests, some range of motion, just kind of get a baseline of what's going on.
Okay.
If you were to bend forward at the waist and go down, any pain in that low back? Nope. Good. If you were to come back like this, any pain in that low back? Good. If you were to come down to either side, any issues with that? Nope. Good. And if you are to rotate over either side? Good. All right. I'm gonna have you lay on your back first for me. On your back. On your back.
Oh, my back.
You're good. Okay. So what I'm gonna do, I'm gonna raise this leg up. Let me know if you have any pain in the low back or the hips. Any issues? Now, granted, you might have tight hamstrings or calves. Okay. I'm going to flex this down. Any pain with that? No. I'm going to bend this knee. We're going to cross it over. Come down just like that. Any pain in the low back of the hips? Good. And relax. We're going to do the same thing on the other side. Any pain with this? Any pain with that? Good. We're going to bend, come across. Good. Any pain there? Good. All right, I'm going to have you flip over onto your stomach now. Okay. So I'm going to have you bend this knee for me, and I'm just going to raise this leg up. Any pain with this?
A little bit right here.
A little bit right there. More on the right, or is it just center?
On the right.
More on the right, okay. If I bring your leg in like that, is there any pain?
No.
If I bring your leg out like this, is there any pain? No? Okay. So now we're going to do the other side. So same thing here. Any pain with that?
No.
Okay. So you had pain on the left leg, raising the left leg, but on the right side, but no pain with this side. Okay. And we're going to bring the foot in like this. Any pain?
No.
And out like this. Any pain?
No.
Okay, good. Alrighty, so now that you're already laying face down, what we're going to do, we are going to scan the body and we check that symmetry from the right side to the left side. What I'm going to have you do, I'm just going to bring your arms around, right there. Perfect. So we're going to scan that right side, the left side, and we're looking for that symmetry. We're looking for, a nice, normal, equal alignment. So we're going to start in the neck, we're going to palpate down, and then obviously let me know if anything is painful to the touch. Okay, we got a little bit of tension on that, more on the left side compared to the right on that trap there. Okay, so we went from that cervical spine, going through the thoracic spine. Let's see. Yeah, a little bit of tightness right in there. Okay, now we're going through that mid-back area and coming into that low back. Okay, kind of pushing out at me a little bit right through here. Any tenderness in that area? Okay, good. Yeah, it's a little bit rotated as I'm feeling, but good that there is no pain. Okay, now through the low back. Anything bothering you in here or no?
Yeah, a little tender through there.
A little tender through there. Okay. Any pain over that right SI joint?
No.
Any pain directly over the sacrum?
No.
Any pain over the left SI joint?
No.
Okay, good. So we're going to come down here and we're going to check the leg length out. Okay. Actually, not bad at all. I mean, if you were to say anything, it would be the tiniest bit on the left side short, but very balanced, which is a good thing. You don't see that too often. As I scan up, a little bit raised here, but not much at all. Everything is actually looking pretty good through here. So we have, I mean, just the tiniest shortness on that left side. We have some low back pain when palpating and pushing in through here. Now, this is your first time ever getting adjusted, correct?
Yes.
Okay, so it's a first time chiropractic adjustment. Now you've seen my videos, you've seen like the Y-strap and the things that I do, correct? Okay, so yes, basically for her, which is a good thing that she's not in like a crazy amount of pain. It's, you know, it's that low back. So we're really gonna focus right in through here. And we're gonna get everything just moving very well, get any pressure off of those nerves. So let's go ahead and we're gonna start with the Hypervolt, that massage device, and work on that low back for you. Okay, so we're going to go ahead and we're going to start the adjustment up at that cervical thoracic joint between that T1 and that T3 area here. Okay, so we have that little bit more tightness, so we're going to start over here. And she was moving already, just with the distracting here. Okay, let's get a little bit, drop a little bit lower on this side. There we go. Good. Yeah, you just feel, that pressure getting removed and release out those nerves. So, always a good feeling.
Feels good.
Okay, I'm gonna have you take a deep breath in and exhale out. Good. One more time, deep breath in and exhale out. Good. And do one more, a little bit lower. Deep breath in and out. Good. Okay. Take a look at the leg length. Nothing has changed. Good thing. That's how we want it. Nice and balanced. I want to check the sacrum out and see if there's any sacral issues. So we're going to stabilize right here. Raise this leg up. Any pain, tenderness, tightness with that? Good. Relax. Raise this leg up. Any pain, tenderness, tightness with that? Is anyone easier than the other?
No, like my left one was easier.
Which one?
My left.
Left was a little easier? Okay. I want to see one more time. So raise that right leg up as high as you can. As high as you can, as high as you can. Alright, good. Relax. Now raise that left one up. High as you can, as high as you can. Okay. So I do see that. The left one is going up a little bit higher. It's not much, so it's probably just the tiniest bit off, considering that leg lengths were already balanced in the beginning. But what I'm going to have you do is I want you to cross this foot over that foot for me. Perfect. And good. going to do the drops on the table. Okay. So what's happening is, it's just a little bit, but her sacrum is starting to point just to the left side a tiny bit. We're just going to rock it back over that little bit there. 2, 1, 3. Uncross. And bend this knee for me. Good. 1. Get that second. 2. There you go. Good. And relax. Raise that right leg up. Good. Do you notice the difference when raising it? No?
Yeah.
Okay, yeah. It wasn't much, so it's not going to be, a huge noticeable difference for you. But yeah, so that's a good thing. So yeah, it's just that tiny bit. But I know for you, you're having a little bit of pain in through here. So what I'm going to have you do, I'm going to have you lay on your side and face me. Good. I'm going to have you bend this top knee. I'm just going to rotate you just a little bit. There we go. There it was. And roll to this side for me. We're going to bend that top one. Perfect. You see how this side was already like nice and loose, that other one went right away? Yeah, so this side was actually good. Lay flat on your back for me. Bring this down a little bit. Good. And so here we're going to do a leg pull. With that leg pull, you'll feel release in the ankle and the knee going all the way up to the hip. So just relax that leg. Relax, relax, give it to me. There we go. You felt that release?
Yeah.
Good. Okay. I'm going to have you stand that up. Pull you up. I'm going to have you face that way from me. Arms out by your side. Okay, put your arms up and over mine. Yep. I'm going to have you lean back on me. Squeeze your elbows together. There we go. You felt that? Good.
Yeah.
Alright, I'm going to have you take a seat right here. Yeah, so that was a standing intercostal adjustment. And yeah, so when those rib pads aren't fully aligned, it just and pulls them right back into place. So, always a good one. Okay, so what I'm going to do, I just want to make sure that thoracic spine is completely cleared out.
Okay.
Have you cross your arms, give yourself a big hug. Take a deep breath in and exhale out. Good. I'm going to have you relax right there. And so we're going to do the Y-strap. Now this is that manual decompression. You'll feel it all the way from that cervical spine going all the way down. So yeah, you can feel this all the way down to that low back. And if you can pull your hair, that bottom bit through for me. Perfect. Thank you. So I stand up in that Y-axis direction, and we get this very good distraction here.
That felt good.
Relax for a moment. If you were to describe that, how would you tell people who have never had it done?
Loose. I feel relaxed.
You feel just how
I
that
feel,
just pulls the pressure off. Yeah, that I love, like just having that adjustment done. That's like the number one thing to get. Yeah, I'll go.
Yeah, that felt really good.
Yeah, that thing, it just, oh, I know, I love that feeling. I mean, that's why, patients come from all over to see me. I know you came from almost, 250 miles?
250, yeah.
Almost 250 miles to come out here. So now this being your first time ever adjusted.
Oh, I'm coming back. It was great. It was great.
Good. I'm glad to hear. Alrighty. I'm Dr. Joseph Cipriano. If anyone is, ever looking to schedule an appointment, please just go right to the website, drjosephcipriano.com. Send me an email. Love to get you in here. Have a good one, guys.